The hip joint, a ball and socket joint where the thigh bone fits into the pelvis. It's built for stability, movement, and supporting your body during everyday activity. Its main job is to allow smooth motion while bearing load through walking, running, and standing. Over time, the hip joint can become irritated or damaged, especially with repetitive stress or aging. When the cartilage in the hip begins to wear down, it can lead to osteoarthritis, causing pain, stiffness, and reduced movement. A labral tear often affects active individuals after twisting or pivoting, causing clicking, catching, or deep joint pain. Hip impingement occurs when extra bone causes the joint surfaces to rub abnormally, limiting motion and creating discomfort. Bursitis develops when fluid-filled sacs around the hip become inflamed, often causing pain on the outside of the hip. Some hip conditions can improve with rest and therapy. Others may require injections or surgery to restore proper function. Hip arthritis, a condition where the cartilage in the hip joint wears down, disrupts the smooth motion of a ball and socket joint built to carry load. As cartilage thins, bone begins to contact bone, increasing friction inside the joint. It develops over time from wear and tear, injury, inflammation, or loss of blood supply. Early, it feels like stiffness or tightness deep in the groin or hip. As it progresses, pain becomes sharper, more constant, limiting walking, bending, and daily movement. Osteoarthritis develops slowly as cartilage wears down over time, leading to gradual stiffness and pain with movement. Post-traumatic arthritis follows injury to the joint, where damage changes how forces move through the hip and speeds up breakdown. Rheumatoid arthritis is driven by the immune system, causing inflammation inside the joint that leads to swelling, pain, and stiffness. Avascular necrosis occurs when blood supply to the bone is lost, causing the bone to weaken, collapse, and damage the joint surface. Have you ever wondered how long an artificial hip actually lasts? The answer might surprise you. The hip is a ball and socket joint that lets your leg move smoothly in every direction. But over time, conditions like arthritis can wear away the cartilage that protects this joint. As that cushioning disappears, the bones begin to rub directly against each other. This leads to pain, stiffness, and difficulty moving. When the damage becomes severe, a hip replacement may be the best option to restore function and reduce pain. The procedure begins with an incision over the hip to access the joint. Once the joint is exposed, the damaged ball at the top of the thigh bone, called the femoral head, is removed. Next, the socket is cleaned and reshaped to remove damaged cartilage and prepare for the implant. A new artificial socket is then placed securely into this space. The focus then shifts to the thigh bone. A channel is created inside the femur so that the implant can be properly positioned. Once the alignment and fit are confirmed, the final implant is placed into the bone. The new ball is then connected to the stem and positioned into the new socket. Most hip replacements last 15 to 30 years for 90% of patients, and the longest has lasted over 70 years.